Колеги, дами и господа, од мое лично име и од името на Македонското имплантолошко здружение, сакам да ви се заблагодарам што денес, на 17.10.2020 година, одбравте да бидете со нас. Воедно сакам да се заблагодарам и за големиот интерес и учеството во донаторскиот сегмент на Македонското имплантолошко здружение. Тоест, средствата кои што сите вие, тоест ние ги издвоивме за овај симпозиум, ќе бидат донирани за 1000 годишнината на Бигорскиот манастир, поточно за поддршка на нивниот центар за борба против зависност.
Добро утро, добар ден. Да ве поздравиме уште еднашка. Од името на ДДДММ Имплантолошко здружение на Македонија и од свое лично име, бидејќи земате учество на третиот симпозиум, кој што воедно и прв онлайн симпозиум на нашето здружение. Годинава, поради новонастанатите услови предизвикани од ковид пандемијата, бевме приморани да го откажеме нашиот долго најавуван настан имплантолошка недела. Самиот настан требаше да биде еден вид на забава, проткаена со споделување на искуства, голем број работни курсеви, едукација на највисоко ниво и секако зближување и дружење на колегите кои се во допир со најмладата гранка на стоматологијата, тоест имплантологијата, или во блиска иднина би сакале да бидат дел од неа. Следејќи ги протоколите на државно ниво, оваа година се одлучивме нашиот настан сепак да биде одржан во малку скратена форма, во која нема да недостигаат основните постулати по кои нашето здружение е познато, а тоа се пред се квалитетните предавања и еминентните странски и домашни професионалци. Средствата кои ги уплативте под формата на котизација за симпозиумот ќе бидат донирани на манастирот Свети Јован Бигорски по повод 1000 годишната прослава и како подкрепа на нивниот центар за борба против зависности. Истовремено голема чест за нас, како организација на овој настан, е присуството на експертите од областа на имплантологијата од една страна, но од друга страна големиот интерес кој што владееше кај колегиите за овој настан. Чест за мене е што сум модератор на овој настан и што имам привилегијата да го најавам првиот наш предавач кој што доаѓа од Јапонија, професор доктор KAMIURA, кој ќе представи еден нов концепт во имплантолошката пракса, а тоа е фацијално водената имплантологија. Чекај се уште.
Окей. いいのかな？始めていいのか？これか。いい？大丈夫？聞こえるかな？いい？大丈夫かな？出てる？下のあれも出ちゃってる？あ、そうか。あ、それは消すわ。これいいよね。これ見えてますか？あ、本当。あ、そっか。そしたら、いや、いいか、じゃあこれで。あれか。発表そのとなっちゃってるんだ。ああ、そっか。逆に言うと字幕付きで見える。あ、でも、動画が見えないもんな。ちょっとそれ1枚ずつ流してくる。じゃあ、ちょっと待ってね。あれどうしたらいいかな。後ろのモニターに映らなければ外してしまったら。あ、これ逆になってるのか。メイン画面にしてやる。ああ、そっか。ちょっと待ってね。ソーリー。これすごいな。これいいんだ。これ大丈夫？
Estimate colleagues.
Okay.
Estimate colleagues. On behalf of DDDMM Implantology Association of Macedonia and mine, I would like to extend our greetings to you for taking a part in our third symposium, which at the same time is the first online symposium organized by our association. This year, due to the COVID-19 situation, we were forced to cancel our long-announced event, Implantology Week. The event itself should have been type of fun event, interwoven with sharing experience, with numerous working courses, education on highest level, and course with socializing and making acquaintances between the colleagues that are in contact with the youngest field of the dentistry. The implantology would like to be a part of it in the future. Following the protocols implemented by our country, we have decided for our event this year to be held in a shorter form, which will not lack the basic postulates of our association is known for, such as quality lectures and the prominent foreign and domestic professional. The registration fee we have paid to the symposium will be donated to St. John the Baptist Monastery in the event of their 100 years existence celebration as a support for their Center for Battling Addiction. Also, a great honor for us is like organizers of this event is the presence of various domestics and foreign experts or field in implantology and the great interest for among of these colleagues. It is honor for me as moderator of this event for having the privilege to announce the first lecture our friend from Japan, Professor Dr. Yoshi KAMIURA, who will present a new concept in implantology practice, which is the facial water implantology. Professor KAMIURA, stage is yours.
Thank you, Chairman, Dr. Denis Baptisteri. I'm glad to have my presentation in Macedonia Society of Dental Implantology. I'm Yoji KAMIURA, ITI Section Japan Communication Officer. Today's title is Current Status of Facially Driven Implant Treatment. This is our digital dentistry team. We are 3 dental technicians and 8 dental hygienists and 4 dentists. If you have any questions, please write a Q&A or chat in English, please. I want to talk about smile and health. Firstly, secondly,ついこれで固まってるな。Sorry. いや、こっちが固まっちゃってるな。この動画が、動画、またあれだ。難問だ。ちょっと待ってね。これ、再起動どうだったかな。もうちょっと。さっきとオプションコマンドエスケープだよね。再起動いかなくなっちゃった。あ、こっちか。あ、わかった。大丈夫。こっちで。あ、これ大丈夫だ。Sorry。でも一回立ち上げる。なんか重たいな。よし、ちょっと待って。 Wait for a minute.君、そしたらさ、そっちの方で見せてもらおうかな。これ、画面のあれしてるから重たくなってんじゃないかな。これを外してみる。一枚ずつ流してってくれる？
Professor, we have some problems.
Oh, my presentation shut down. Okay. Sorry.
No problem.
これでこう、一枚ずつ流してくれるか悪いけど。それは大丈夫だわ。画面共有してるから。いったかな？大丈夫？じゃあ、だからこれで、ここをちょっと飛ばしていきます。うん。いいよね。Sorry. Secondly, I will show you patient visualization or facially driven treatment. Finally, you can see a clinical case with 3D facial driven treatment. これか。
Please go on full screen.
Oh, okay. いいね。Almost fully edentulous 65-year-old female was referred to our clinic for aesthetic and functional dental rehabilitation. After implant placement, skill retained final prosthesis with zirconia frame were delivered both jaws. She was very happy to her new dentition, so she can make her new smile. She can smile with big mouth.これはいいか。これない。Smile contributes health as below. Blood pressure decrease, natural killer cells increase, we can more relax. To give patients a smile, certainly a lot of digital data is needed. Dr. Christian Kochman called this procedure patient digitalization. From now, I will explain essential digital data collection for patient digitalization. For example, CBCT, intraoral scanner, 3D face scan, and procedure of superimposition. You can see the list of instruments about digital examination. Conbeam CT, iOS 3D camera, and CAD software. Next. At first, I will explain how to get jawbone data from CBCT and dentition data from intraoral scanner. A high-speed CBCT device, Morita 3D Akitomo Japan, is used to scan the patient with the following setting. Field of view is 120 mm height, 107 mm width, high resolution, voxel size 0.0 mm, and effective exposure time is 8.5 seconds. The patient's head was properly secured on the CBCT scanner chair by means of the head frame positioner. The chin rest and support were not used to avoid any restriction to the muscle movements. We used 3-shaped trios in intraoral scanner. つまり、今の動画で
国内スキャナーといってですね、歯列ですね、それを取る、この3つは全て、揃ってなきゃいけないのと、それを国内スキャナーといってですね。
If you use CBCT intraoral scanner, you can perform full digital treatment. In full digital treatment, the number of treatment time and the period decrease compared to analog treatment. In single tooth implant restoration case, only 4 to 5 times visit is needed. これ動画だわ。You can see the clinical procedure of my single tooth restoration case. It took 4 hours and 70 days to restore single tooth with implant. October 11, tooth number 46, distal root was extracted, implant was placed November 2nd, 22. Final restoration was in set December 12. 4 weeks after the implant restoration, final restoration was set. You can select super early loading 3 to 4 weeks in case of field some conditions. これも OK ですね。あげます。This slide shows before and after implant placement. It took 4 hours and 7 days to restore single tooth with implant. In anterior situations, treatment plans must be guided by the face to obtain aesthetic and functional results. A great challenge in rehabilitation patients with anterior partial edentulous has always been to relate the face to a definitive restoration and fabricate diagnostic wax patterns in harmony with the face. Facially driven implant is a concept that includes restoration driven implant. I will introduce my 3D camera extraoral optical surface scanner. I recommended Bell 3D for 3D camera to obtain 3-dimensional face surface data. We used 4 types of 3D cameras. We recommended Bell 3D for moderate low price and precision images. これ動画だな。Please watch the video how to use Bell 3D. About 2 minutes. automatic jaw and face and CBCT matching. First, we start with the 3D face scan.
Професорот во текот на првиот дел од своето излагање покажа дел од протоколот и технологијата по кои тие работат, така да пациентот прво го испраќаат на CBCT анализа, потоцна земаат дигитални отпечатоци со користење на дигитален интраорален скенер и сега е моментот на фацијално скенирање, тоест на скен на лицето на пациентот. Сите тие три податоци добиени од CBCT-то, од интраоралниот скенер и од фацијалниот скенинг ги собираат во еден сегмент и целта е правилна, точна и естетски 3D позиционирана имплантологија.
We recommended to stand for tablet PC or iPad to prevent camera movement. According to take photo environment, a patient have no glasses, must tie back long hair, and so on. When the amount of light is insufficient, use ring light supplementary for tablet PC. You can see how to take 3D photo with 3D camera called Bell 3D. After taking 3D photo, you can see 3D face with software. This is 3D face data of me. You can check the data using free software MeshLab. MeshLab is free software. Next, superimposition and diagnostic mock-up. So we got the data, jawbone as DICOM data, dentition as STL data, and 3D face as OBJ data. These three data is perfect and important. This is a movie of superimposition of jawbone and dentition and face, and with CAD/CAM software, Stroman cares visual. This is a screenshot of superimposed data frontal view. Translucency of face increase in this data. You can see relationship between face and dentition. So occlusal plane can be checked without faceball transfer. Before 3D mock-up design, 2D smile design was recommended with smile design software. In the digital workflow, the challenge remains the same. Only now these facial references need to be transferred to the virtual CANs, the planning software program. 動いてる？動いてないか。あ、これからかね。あ、ごめんね。This is a movie of 2D smile design. まあ、これいいかな。ね。はい。You can see before and after photos with my face. Gami Smile is improved with Smile Design software. Referring to this improved photo 3D Smile Design mockup will be performed with Stroman Care's visual software. これ動かない。自分で動かすか。動いてる？またあるか。あ、動いた？これで少しずつ動かすしかないわ。ねfrom superimposition data digital mockup。あ、これいったな。あ、これか。いった。どう？ From superimposed data, digital mockup design was made with Stroman Care's visual. This is called facially driven restoration. あ、違うね。また止まった。うん。ちょっとまた動いて。うん。こっちは最後までいったな。モックアップ終わった？あ、これモックアップだ。あ、今モックアップ出てきた。うん。よし、じゃあこれでいいわ。ね、よし。From 3D mockup design data, dentition model and mockup PMMA were fabricated in almost 60 minutes with 3D printer. Stroman P30. You can see the images of model and mouth and of before and after. These are images with and without mockup. Do you think which is better, right or left? These are movies with and without mockup.
それではですね、デジタルデザインで
歯を直したいと思ったきっかけって何か
3D プリンターで作ったんですね。
小学校の頃と友達にバカにされました。
これとこれをもうこれを入れ
今
て、
どうしてこのタイミングで歯を直そうか
入れた感じ。
もう今残したら一緒やらないかな。
ね、出っ歯だから
ね、50代
ますよね。
なんかこういう歯になりたいなみたいな芸能人とか理想とかって
トム・クルーズですかね。
あ、わかりました。ありがとうございます。
ここも負けてないの大学生。
に。
よし、これよし。Let's think about possibilities of virtual articulator. We used Facebook transfer to know the relationship between TMJ and dentition. Now we can get the DICOM data of almost full skull. My CBCT is Morita Akitomo 70. This image is my skull data. From this data, the distance from TMJ to lower incisor and the angle of fossa of TMJ were calculated. In this patient, the distance from TMJ to lower incisor is 73 mm in y-axis, 86 mm in x-axis. The angle of fossa frontal wall is 43 degrees in right, 50 degrees in left. You can see the relationship in between face and the articulator. Please put the data of condyle pathway angle and incisor angle. 次かな。Data of virtual articulator needs to be agree data of the patient. This data means bone wheel triangle, which is made from both TMJ to central incisor. 次かな。Please check the harmony between digital virtual articulator and analog real articulator. This is jaw movement in my mouth. This is jaw movement in analog real articulator. This is jaw movement in digital virtual articulator. These movies are jaw movement of real, analog, and digital. They have good harmony.
何回かよ。はい。
Dr. Kochman recommended virtual dental patient creation for facially driven treatment. Lastly, I will show you procedure of digital jaw movement and pronunciation. This method is very easy and need only iPad. With iPad, jaw movement and pronunciation can be recorded. According with movement, direct a patient to move to right, left, and front. According with pronunciation, order patient to speak 50 to 69. We can refer incisor edge position from left hand, ocular vertical dimension from S
そう
hand.
ですそうです。ありがとうございます。戻してください。そうです。はい、ありがとうございます。次ですね。出てきますか。あ、そうですね。ありがとうございます。で、次、61、62、63って順番に言ってもらっていいですか。
61, 62, 63,
64、
4, 64, 65, 66, 67.
In anterior half of my presentation, I explained digital examination as CBCT, iOS, EOS, and I will show how to superimpose from three kinds of data and use virtual articulator. So you can see clinical case with these data and methods. Please watch the video of my patient. 最初前半まで。また、来てよ。これで、ほら。
トイレに来る方でやっぱり前歯がなかったりとか、あとすでに入ってるんですけど、もうそれがもう古くなってこう顔に対して曲がったりとかね、そういう目になっている方がいるので、それを事前にですね、コンピューターでシミュレーションの画像を作って、患者さんに説明すると。で、事前はですね、説明するだけだったんですけど、今はそれを実際の、治療結果に反映できるようになっているというのが大きな特徴かなと思います。今までだったら CT ですね、コンビーム CT っていうね、3次元の、ね、顎骨の状態を撮るものと、あと顔面を撮るですね 3D のカメラと、であとはね口腔内スキャナーといってですね、歯列ですね、それを撮るこの3つが全て揃ってなきゃいけないのと、それを、一緒にやる技工士さんですね、それと一緒にタイアップしてね、 協力し合いできるような技工さんがいないとちょっと難しいんですが、うちの方では、3、4年ぐらい前ですかね、ちょうど準備してまして、ちょうどいいタイミングで、全てが揃ってるので、それが完結できると。
よし。で、吉田さん。よし、これで。This patient is 45 years female smoker and he desired fixed prosthesis in both jaws. These are initial visit photo and pantograph. He lost anterior teeth in upper jaw and posterior teeth in lower jaw. He lost centric stops, so his mandible inclined to left side. His masticaria ability is very low, so he swallowed food instead of eating. This slide is side view. He lost upper anterior teeth, so the mandible and lower lip was protruded. His profile was measured. Nasolabial angle is 84 degrees. This is low score compared average. Labiomental groove is 1 millimeter. Holdaway angle is 10 degrees. All of these are low scores compared to average. You can see his missing teeth condition. He lost anterior teeth in upper jaw and posterior teeth in lower jaw. Upper teeth in anterior were lost, so anterior guidance is lost, and mandibular was protruded. Facial midline was drawn. We check relationship between face and teeth and displacement in mouth opening. In facial side view, lower lip was protruded, but upper lip is almost normal. This is soft tissue analysis by Dr. Annette. Lower one, this is almost okay. So increase of occlusal vertical dimension is not needed. Facial tape is dolicho, and we must caution too much bite up. Minimal vertical dimension up is needed. You can see CPI data. CPI data can demonstrate jaw displacement. His jaw was depressed to right frontal. CBCT data shows right TMJ position pressed to anterior. For counseling to patient, digital smile design was made with Torio software.これ結構スムースじゃない？ねえ、なぜか。違うのかな？あ、これちょっと撮ってくれる？なんかやってると。彼、君ちょっと片方だけでさ、ね、写真でやってるとこ、彼も、時間がもう、大体いい時間ですけど。いいな、よし。He consented to his new smile made with 2D smile design. Nowadays, we can make three-dimensional smile design. In this periodontal case, we can 3D new dentition. This is another case. 次。With Stroman Care's visual, 3D new dentition was made and 3D model is fabricated with 3D printer for counseling to the patient. This is his smile. Return to original case, centiculation, occlusal plane, anterior guidance, aesthetics was improved with provisional restoration and implant prosthesis. Vertical dimension must be increased minimally. Treatment. In this case, occlusal vertical dimension was decided with AB distance. Green point green. Average AB distance is about 38 mm in male patient. Point A is mucogingival junction in upper jaw. Point B is mucogingival junction in lower jaw. Occlusal rim of 38 AB distance, millimeter 30 distance, AB distance was manufactured previously. Occlusal plane decided with pupil line in frontal view, campal line plane in lateral view, and vertical dimension was decided with AB distance. In this occlusal rim, CR bite, centiculation bite was recorded with silicone material. This is analog method. Analog check digital treatment planning. Study model was mounted to semi-adjustable articulator, carboproter with baseball transfer. Differing Japanese norms, distance between upper mucogingival junction and incisor edge position is 22 mm. AB distance is 38 mm. This tooth supported provisional restoration was reinforced with cobalt chrome frame. Tooth supported provisional restoration was set in this patient. You can see initial and provisional restoration photos. Occlusion, aesthetics, pronunciation, mastication was checked with the provisional restoration. With this provisional restoration, his face looks young and the mandibular was centered because of both sides mastication. Please check his face with iPod movement.
今後治療するにあたってどのような歯になりたいとありますか？望んでいること。上の歯にカリバ入ったんですけど、どんな感じですか？歯並びとかも。なんか。わかりました。ありがとうございます。
In cephalometric analysis, minimal increase vertical dimension was confirmed. After confirming that there was no problem with provisional restoration, surgical guide was planned with co-diagnostics. In Stroman system, Synergy Link can be used with surgical guide software and CAD software. You can see the surgical guide designed procedure with facially driven implant. Intraoral scanner and 3D test was imported to the software. From ideal tooth from the provisional restoration, implant position was decided three-dimensional. We can check new occlusion with vertical articulation. これいいか。どうすで次、This is completed to supported surgical guide in upper jaw. With surgical guide, implant were placed with plant positioned previously. This is flapless approach. In lower jaw, implant were placed with flap approach. Lower anterior teeth were planned to be moved to distal. So implant second premolar was placed 1 millimeter distally. Patient gets secure centric stops in only 3 months with lower implants. From stable centric stops, he can bite both sides, so anterior displacement right TMJ was moved to central. Occlusal plane and mandibular displacement were improved with implant-supported fixed dental prosthesis, and his occlusal face force was increased 3 to 4 times comparing initial visit. You can see the movie of designing implant-supported provisional restoration in upper jaw with Stroman CAD software CAD visual.これが一番わかりやすいんじゃないかな。海外とかの静止画だとちょっとわかんなくてもね。こんなのわかるのかな、何を言いたいかって。そうです。これ大切だと思う。全部これでいけばいいんじゃないね。半分ぐらいね。山田の動画で言った方がいい。よし、じゃあいいかな。はい。次。Implant supported prevention were set in both jaws to improve occlusal plane and midline. Orthodontic treatment was applied in lower anterior teeth. Please check his face with or without previous restoration. So we can check occlusal plane in this side. With facially driven implant treatment, he recovered natural face. With facially driven implant treatment, mandibular protrusion was improved. もちろん、これ直す。じゃあ次に。長めに直して。In Arnett soft tissue analysis, position of upper and lower lip to vertical line is improved. In another analysis, nasolabial angle, labiomental groove, and holdaway angle were improved. よし、これで最後。ビデオ。And please see the video only 2 minutes.
やってみたいというか患者さんも知らないので、そこまでどこまで治療がいくかっていうイメージが湧かない患者さんやっぱり多いと思うんです。そういう人には僕らが今ね行っているような 3D で患者さんにこう治療結果を提示するということは、非常に有益ではないかな
と。もともとは差し歯だったんですけど、それが取れて、あとやっぱりご飯を食べづらいで噛めない、あと笑えない、要するに前歯がないもんで、 前歯を見られたくない。食事やもうほとんど奥歯残ってる歯で噛んでた感じ。笑えるようになりましたね。焼肉がめちゃくちゃ好きで、週1、2で焼肉屋さんに行ってます。これからの人生って考えたら、全然やった方が良かったと思います。
最後それで。開かないな。Thank you for your attention. I finished my presentation. Thank you. 特にないかな。まとめ作るか。英語。うん。最後なんか作ったの。英語だって作ってなかった。
Professor, we are finished.
Yes, I finished. Sorry.
We are finished with presentation.
Yes.
Yes. Thank you for all. We continue. За нас денеска представува особена чест што професор доктор Енис Реджеп ја прифати поканата на Сдруженијето и што со нас денеска ќе сподели дел од своето богато искуство во областа на компликациите во имплантолошката пракса. Професоре, може да започнеме.
Добар ден на сите, дали се слушаме?
OK。次の先生いいのこれ。それいいのかなこれ。